Good morning, judges and my dear friends. Today I'm going to talk about a unique trainee survey that we conducted using a virtual reality simulator, which involved in suturing a scleral incision. I am a consultant at one of the simulation development centers.
Yeah, you please speak loudly.
Suturing is the most important skill required in the management of anterior segment trauma, especially for residents when they begin their residency training. It is essential that we teach them to practice suturing well before one goes ahead and does that in real life surgery. However, post COVID-19, we know there are limited number of eyes and limited number of training opportunities. So how will we help the trainees master this basic skill in suturing, especially in cases of anterior segment trauma or a leaky tunnel wound? With that aim in mind, we went about formulating a questionnaire where we would evaluate the trainee performance on suturing using a virtual reality haptic feedback based simulator, and to identify in the long run if a training course around such a simulation procedure as a proof of concept will help the trainees learn suturing in a better and a controlled manner. With that in mind, we identified 5 trainees who underwent 2 tasks on the simulator, and they received first orientation on the simulation, and then which included theory class orientation sessions and practical sessions on the simulator, which were also instructor led. We focus mainly on 2 basic steps where we know the residents and the trainee find difficulties passing the needle to the correct depth, involving the correct length from the incision, and tying those knots, especially the 3-1 or a 3-1-1 forward, reverse, and forward technique. And we help the trainees achieve such 25 tasks. We prepared a questionnaire which was filled out by each trainee, which was to know their performance and to know the confidence that they gained after undergoing this surgical training. So this consisted of the simulator, which again has a haptic feedback mechanism. It helps the trainee guide the incision and the exit points and the correct depth of the needle. There are guidelines which helps the trainee know everywhere how much is the depth that they have inserted within the sclera, so that as they practice more and more, it becomes more like a muscle memory to them, so that once all these guiding tools are removed and when they go in real life surgery, they feel much better to continue like that. And the next step that was taught also consisted of making the knots, which involved doing the throws that we do, whether you're doing forward, reverse forward, 3-1 or 3-1-1. Those steps were done on the simulator, and then the trainees were given a questionnaire that was filled, which was also objectively assessed. There is an objective assessment on the simulators which tell us the exact depth, the distance where it was passed, and the throws that the trainee did while suturing. We gave the questionnaire and the responses were noted. These were blinded, and the trainee responses were analyzed. We could rate that all the trainees, when they were suturing, they said that they were 100% confident in manipulation of the eye using a colibri forceps, including complications like UL touch. They were very confident. And how would you rate the experience in reaching the correct depth with the needle holder? Almost 80% felt that the depth that they could attain every time while doing the task was good. They were confident, and they were really hoping that they would replicate the same when they go on real life surgery. Tying the knots was a little bit complicated because maybe suturing requires a lot more orientation to do that, but even here almost 80% were happy and extremely satisfied to do that, and most of them reported that they were confident learning these on these 25 attempts and going to suturing. So all the participants felt that manipulation of the eye was as real as in real life surgery. The haptics and the visuals that the simulator offers provides better control of the instruments, and they were happy with the needle depth insertion of the sclera, which was almost 80% realistic as reported in the trainee questionnaire survey. Using the straight or the curved tying forceps did not change much, but we did see a mixed response. And all trainees felt that the simulator was able to alert them in case of complications. When the needle goes too deep, it was telling them that it's too deep and you will have a complication going forwards. However, all trainees felt that simulation-based training increased their confidence, and they felt that their skills were enhanced using a virtual reality haptic feedback simulator. So to conclude in our study, the use of a virtual reality haptic feedback simulator affords an opportunity for the residents, the beginning surgeons, to have the feel of a normal tissue without actually spending time or learning those on the real eye and causing complications, but to learn here, have a good muscle memory, and go on the live surgery with confidence. The aim of the study was to impart confidence. It also reduced the learning curve. This was just a proof of concept. We wanted to see whether it will be further done into a training program where we'll have a structure around it. So we are happy that the proof of concept works, and it encourages us to develop a training program around it. And the use of this device in a teaching situation has demonstrated that the instrumentation is useful in learning suturing in case of anterior segment trauma or a leaky tunnel. I thank you for your attention.
That's a good idea. In the present phaco era, most of the people, residents, are not accustomed to suturing, and this is a very good technique to learn suturing. But the important thing is that how much was the availability of the simulator to the residents?
Yes, the availability is an issue. We are a tertiary based center. I'm also associated with the government medical college, so I can have the access for my residents to the simulation based training. It's at a very nascent stage in India. The availability, the transportability, or the logistics of it does not support on a worldwide scale, but bodies like AIOS or Maharashtra Medical Council, Dr. Bhide is also here, support residency training for simulators. So it is picking up. It's very slow, but yes, it can be made available in the near future.
Help Me See should support associations like MOS.
It is very, I think, I will say in a country like India, it is very rarely present.
That's right.
At rare
It's
places.
a very good paper. It's a good concept. You have shown suturing, but can you have a simulator for trauma cases like corneoscleral suturing? Because the tissue field will be different for cornea and sclera.
So now that the presentation is over and I've declared the financial interest, yes, we are developing a trauma module for learning for the residents, because we see that they don't know how to even handle the needle and do
How
suturing.
to hold the tissue.
Exactly. So we are developing a corneoscleral laceration module soon.
With UVL tissue prolapse.
With UL tissue prolapse, yes.
Okay, thank you.